Hi, my name is Timothy Valdez, and this is my community assessment of the East Valley Community Health Center in Pomona, California. This is the map, the area that I chose to look at. It's a 2.9 mile radius, and it's bordered by the 10, 60, and 71 freeway, and the land area total is 23 square miles. The clinic is in Pomona, California on Gary Avenue. It is called East San Gabriel Valley, or it serves the East San Gabriel Valley Pomona communities. It has a large parking lot, accessible ramp entrance, a comprehensive automated answering system for their phone network, and then they also have unique patient portals. They accept Medi-Cal, Medicare, and covered California and uninsured patients in accordance with eligibility requirements, meaning uninsured people will not be turned away and they will be helped for sure. Patients are majority Hispanic descent, and this is primarily outpatient facility. It's a nonprofit 501c3, and see on the right here has patient-centered medical home. It's recognized for their type of treatment that they deliver. There's 44 clinicians right here. You can see that there is 4 dental surgeons and 4 dental doctors. So it's very unusual for a clinic, especially in San Gabriel Valley, to serve a wide variety of illnesses and also serve community's dental needs in the same building. So this community clinic has a lot going on inside. And this is the board of directors and the clinic leadership that helps fund the clinic through philanthropy. The top right is a picture of the front of the clinic. There's a dog actually on top of a space that's reserved for disabled people. So they prioritize disabled parking in the front, and then we will see how big the parking lot is in the next couple slides. So the available resources, we have medical services, there's behavioral health services, there's dental care services, vision care services. And on the top left is actually a picture of the waiting room, how it kind of looks, the design, and the bottom right also. They have insurance enrollment services, and they also have a health education section of their facility that works to educate on prenatal support, and they help show patients how to manage their chronic conditions. What is nearby? So the East Valley is on the bottom left corner. There's a CVS pharmacy about a 4-minute walk. And the top shows that it's actually 11-minute walk away from a Fremont Academy of Engineering and Design, which is one of the 10 high schools in Pomona. This picture on the bottom is a picture of the CVS across from the place or the parking lot that East Valley is in. And on the right is the bus routes. There's 2 bus routes that go up and down Gary, and they stop right in front of the Community Health Center. So these pictures show what's around the clinic. The bottom left shows a mobile home. So there's a mobile home facility right next to the clinic, or affordable, also known as affordable home facility. And the top left shows the streets and how they're shaped. A lot of the streets have cracks in it, especially on the main roads. Definitely needs to be upkept, but especially Mission Boulevard, which I personally driven on multiple times. And the top right shows another landmark in the city is the Western University of Health Sciences. So looking more at the demographics, the city of Pomona is 151,000 people big, and about 34% of the residents are born out of the country. So and most of those people are from Latin America, which we'll see in the next couple of slides. But the city of Pomona primarily speaks Spanish. And there is Another statistic on the bottom right that's important to understand about the community is 85% of students receive free or reduced lunch in Pomona. And on the left of that chart shows 1.49 acres per 1,000 population. So that's just signifying the low amount of recreational area that's available for parks and such. So the area available for recreational space is way lower than Los Angeles County. Pomona poverty demographics, overall poverty rate 17.93, with Black and Latinos or Hispanics being the largest populations in the poverty margins. Looking at these charts, top right corner, percentage of uninsured adults. So 30% of adults in Pomona are uninsured, which is higher than the county average, which is shown in the black. And then teen births under it is pretty high compared to the county. The percentage of low birth weight is at 6%, which is pretty high still. And California Healthy Places Index score, they were rated 19th percentile. Looking at the neighborhood, there is a community arts center, the Doss Center for the Arts, which is primarily a community gathering space where they hold events. A lot of schools use this space too, I know, for different projects. When I went to the Claremont colleges, I actually worked with students from Pomona High School, and we put on a show at the Doss Center. And then these other pictures of the train station, bus station, public library. There's 0 preschools in Pomona, which I thought was interesting. And there's 29 elementary schools, 13 middle schools, 10 high schools. There's a large non-citizen population, and they are from Latin America, 85.4% to be exact, or to follow the chart on the top right. And the bottom chart shows homelessness in Pomona. And the total persons counted January 2020 was 722, which is extremely high for California and for the US. It's higher than one of the largest, it's higher than Los Angeles County, or than Los Angeles, the city, and Inglewood also. So policy scan, Ordinance 4290 was to stop evictions for those individuals who were affected by the COVID pandemic and couldn't pay rent. Urgency Ordinance 4300 was premium pay for retail workers. It added $4 to pay due to the pandemic. And Ordinance 4126 was actually from 2009, and it is a noise ordinance penalizing individuals with a misdemeanor if they were responsible for loud or unruly gathering. So SWOT analysis, let's look at the strengths. 2 online portals for patients and also for dental patients. So there's a patient portal and then there's a dental patient portal, and they offer telemedicine, which is a technology that's really connecting medicine through the internet. So individuals are able to access clinicians' advice from home. No one is definitely turned away, which I think is a really important part of the clinic. Even if they're uninsured, they help you find options. And one of the weaknesses is they have a lot of long wait times, whether it's the phone call holds or wait times for certain types of care. There definitely is walk-in care available, but certain types of care that involve like dental exams or other type of exams, those might have a longer wait time. For opportunities, there's a lot of opportunity for outreach to trans LGBTQ plus youth. There is a greater need for communication with other clinics. I believe that there's about 2 other clinics that are like very close to East Valley, but they don't necessarily communicate with each other. And I think it would be interesting to see how they can learn about different needs the community might need or might not currently are being met. For the threats, the COVID-19 pandemic definitely gave a lot of obstacles to individuals receiving care. There's a nonprofit budget that limits personnel. So there is a cap of how many people can be seen per day just due to the limited number of clinicians. And the reviews on Google are very alarming because individuals had good experiences, bad experiences. So it was interesting to read people's experiences in the clinic, whether they were uninsured or whether they were someone who was on the phone and couldn't get through. So I recommend better advertisement, especially to youth and families who are underserved. I think it's if possible, they should continue their school site clinic program that they were offering before it was closed. It was discontinued due to the pandemic, but I think that the need is still there, especially for vaccinations. And the clinic could also benefit from an increase of telemedicine use. Hopefully, it will open up availability where individuals who don't necessarily need to see a doctor in person can stay home and have a easier, more efficient session. And this is the East Valley Community Health Center's assessment. Thank you. These are my references.